Welcome to a brief introduction to cardiac rehabilitation in South Africa. Cardiac rehabilitation is a program that helps cardiac patients resume a healthy lifestyle after a cardiac event or any related cardiac procedure. The goals of the program are as follows. Firstly, improve your cardiovascular fitness by optimizing your recovery of your heart muscle by participation in a controlled and supervised exercise program. Abnormal responses and problems can be identified during the exercise sessions. The program will help to modify or manage your risk factors. The program offers psychological support and also socializing opportunities. And lastly, provide assistance in lifestyle adjustments. Having a heart attack is an overwhelming experience that causes anxiety and depression. With the program, you will improve your physical fitness and exercise safely. It will also help you to manage other cardiovascular risk factors. Some people need to make huge lifestyle changes and get used to all the new medication. There are 4 phases of cardiac rehab. Phase 1 is the in-hospital phase. Phase 2 is the first 6 weeks with gradual return to everyday activities and usually following a walking program. Phase 3, from 6 weeks on, you will start to increase your exercise tolerance with additional strengthening. Using the wireless custom-made cardiac rehabilitation system makes it so much easier to monitor the cardiac patients. And lastly, phase 4, which is usually the ongoing maintenance. The following patients will all benefit from cardiac rehabilitation: myocardial infarction patients and those who had coronary artery bypass graft surgeries, angina patients, patients with stent implants, chronic total occlusion percutaneous coronary intervention, the newer method, valve replacements or valve repair patients, patients with cardiac arrhythmia such as atrial fibrillation, and those with pacemakers or intracardiac defibrillators, heart failure, cardiomyopathy, or any patients with a low left ventricle ejection fraction. And lastly, the very few heart transplant patients. Biokineticists are qualified to manage and oversee the cardiac program in collaboration with other medical professionals. They are registered with the HPSCA and specialize in exercise testing and exercise prescription for any patient with any chronic medical conditions such as coronary artery disease patients. The evaluation entails medical history and lifestyle assessment, together with fat percentage, ideal weight and waist-hip ratio. Most importantly, the stress ECG and blood pressure response during an exercise test protocol to determine your optimal exercise heart rate and your maximum heart rate. Special tests for orthopedic problems can also be included, and very importantly is the education regarding the cardiac intervention or the diagnosis. Help cardiac patients and their loved ones to thrive, not only survive a cardiac incident, by doing cardiac rehabilitation for better quality of life.